Hi everyone, today we're going to look at this CT brain of a 20 years old female patient, and the clinical presentation is sudden onset of headache and aphasia. Okay, so let's take a look at the plain CT brain, in which we will also commonly will order a non-contrast CT brain initially to have some quick idea anything going on first. Okay, so let's quickly scroll through that. Do you see the abnormality? Sometimes for junior doctors, they may not pay attention to the abnormality that I'm going to show you. Okay, so let me draw your attention to this hyperdense clots formation, which is within the basilar artery, and it is the pons area. And the basilar artery is located at the central pontine sulcus, okay, at the pontine region. And usually, if you see there's acute thrombosis here, it is actually supplying important arteries to the brainstem. And this kind of patient usually presented with very significant neurological deficits. Most of the time will be unconscious, because you know that at the central portion of this pontine region is what we call the reticular formation, which is very essential for the consciousness of the patient. Okay, so let's remove the annotation and try to see any genuine infarct. Basically, do you appreciate that there is additional hypodensity here? Okay, which is even more hypodense than the normal white matter. Of course, gray matter is here and white matter is here, and do you appreciate that this additional? Sometimes you may be quite confusing, because you may sometimes because of the presence of very dense petrous parts of the temporal bone, there may be some artifacts, but in this cut it cannot be accountable by artifacts, because usually artifacts should be streak-like, and at the same time only this portion is hypodense, and the petrous part of the temporal bone is not significantly occur in this cut yet to account for the artifact. Besides, you can scroll through the images and see that, okay, so these are the genuine streak artifacts. Do you see that? Band-like, okay? Just like a sun ray appearance. It should not be a patchy area like this, okay? This is not an appearance of artifact due to the presence of the temporal bone, okay? And you can trace that it is suddenly having an acute thrombus within the basilar artery till the tip before it bifurcates to the terminal branches, okay? If you are not very familiar with the posterior circulation anatomy, you can take a look at my other tutorial on that, okay? And then you will know where you can look for this review area later, okay? And then we try to do a CT angiogram to confirm our diagnosis. So basically, if this is a patent artery, it should be well opacified with the contrast. But if it is having some clot inside here, you see that the lumen is completely non-opacified. And later on, you'll ask the question, okay, why the basilar artery is occluded, but there is still arterial flow to the terminal branches like the PCA, posterior cerebral artery? The main reason is they are getting the blood from the posterior communicating artery, okay, which is drawing the blood from the ICA here and then through the posterior communicating artery and then reaching the terminal branches here. But of course, this is not a very sizable communicating artery, so even though there is still opacification, it may not be sufficient, okay? So it may still have some symptoms sometimes, but of course, what is the most significant is where the clot located, and the pons really do not have any communicating artery or all kinds of collaterals to perfuse them, so that's why they develop infarct there.